Hello and welcome to Office Hours. I'm David Bird, your host, and I'm joined by Infinix's co-founder and CEO, Jaideep Tandon. Today we are going to reflect on 2023 and some of the opportunities we have faced this year. Everything from staffing to AI, M&A, and a host of other topics. If we can pack them all into the 30 minutes we have. If you have any questions, please post them and we'll be sure to get them to them at the end of the session. Hi, Jaideep, and thanks for joining us.
Great to be here, David. Look forward to today's session. We've done one earlier. I really enjoyed it, so really excited about this one as well.
Yeah, you've done quite a few office hours now, so I think the market and the audience pretty much knows who you are and what your role is. But as co-founder and CEO at Infinix, one of the things that I've always wondered, but really have never asked for some reason, and I'm going to use this forum selfishly to ask, especially since we're reflecting, what inspired you to start Infinix?
Wow, I could probably take up the entire 30 minutes, but I think to keep it brief, I'd say it all came together sort of almost 11 years ago now, where we started to hear from a lot of healthcare providers on the increasing burden of administration that they faced as they took care of their patients. And we were fortunate to get our very first sort of customer who said, hey, if you guys can help us out in some of these tasks, there might be something here. And so we approached it very much how we approach things today as well, keeping the customer and their business problem at the center of it all, and understanding what, with all the tools and capabilities available at our disposal, how we address their challenges. The early days, we did medical transcription. Very quickly, we saw that there is an opportunity to help our customers around cash posting and many mid-revenue cycle functions. And just building block by block, we today are able to sort of expand that across the entire spectrum of revenue cycles, right from when a patient is scheduled all the way to chasing the dollars of denied claims. So it's just been a journey of learning from our customers and adapting to the market and using best of breed technology and just working with some amazing people.
Very cool. We are very much a customer-centric and focused company, that's for sure. And I think our NPS scores reflect that. Let's jump in and reflect on 2023 for the audience. The year provided the healthcare industry with a lot of opportunities addressing various nuances, which Infinix addressed through our cloud-based healthcare platform for the back office administration. Before we reflect on some of the opportunities we just mentioned, can you tell the audience a little bit about Infinix's platform and how it can be leveraged for patient access and revenue cycle management specifically?
Yeah, so I mean, our platform has evolved a great deal over the last 5 years, and it continues to evolve. It's purpose-built to manage RCM operations across the entire spectrum, right? Starting from the front-end processes like referral management, insurance eligibility and benefits, prior authorization, and then going into mid-cycle functions like charge capture, coding, and then finally on the back end around AR denial management as well as credit balance. And it's the genesis of combining sort of the subject matter expertise that we've gathered over the years, best of breed technology, and again, an unwavering focus on solving the customer challenges around RCM. So our platform today incorporates sort of the way I like to look at it is technology is our first line of defense, but we don't necessarily leave it there. Our goal is always to provide a end-to-end solution for our customers. So the platform incorporates AI, machine learning, automation, and workflow solutions to streamline all of the processes that I just mentioned around RCM that may have multiple stakeholders within the operations organization of a customer. All of our solutions are EHR agnostic and integrate seamlessly, sort of providing analytics and insights across the board. So you have sort of a centralized dashboard that gives you a complete view of the health of your RCM operation, where the hotspots may be productivity, outcome-based, cash goals. All of those can be brought in and fully customizable. So our goal as always, remains to have a positive impact on our healthcare provider customers and their business operations, right? So a simple example that I bring up often is ensuring that there's an authorization on file prior to a patient procedure, and before the patient comes in. So you're reducing the revenue leakage that might happen as part of that procedure, and second is you don't have to reschedule the patient if you're not able to get an auth on file in time. So every time we look at anything that we automate through our platform, we always keep an eye on what's the impact we need to provide to the customer. And sometimes the platform has to work, the orchestration has to work between the machine and human, and that's something we keep a close eye on.
So streamlining the processes from patient access all the way through RCM, I think, being out in the market as much as we are, one of the things that we heard over and over and over again in 2023 was staffing challenges. We heard that a lot. What factors do you think contributed to staffing shortages in healthcare, and specifically on the administration side?
Yeah, so I think the healthcare industry has grappled with staffing challenges for many years, but COVID is what sort of broke the camel's back. Across the board, the burden on healthcare workers through that time span has continued to increase, and sort of coming out in 2023, the sort of, we could say, the first full COVID-free year, post-COVID year, we saw the problem really have amplified, right? And this is true on the clinical as well as on the business ops side of healthcare. With COVID, the stress levels became untenable, and with other industries experiencing growth in that remote work environment, many healthcare workers for the first time found that there are other opportunities, and their skill sets are very easily translatable to those other industries, and they potentially pay the same or more and provide a better work-life balance. Previous to that, healthcare sort of kind of was this island, and folks didn't necessarily jump industry to industry as much as what we saw during COVID. And in today's reality, the healthcare industry faces the deficit of staff, and I don't see any meaningful way that the gap can be bridged at the current time. So innovation is key in terms of how healthcare providers and healthcare industry in general starts to look at that stuff, right? So they'll need to look at new specialized technology solutions, staff augmentation, and generally evaluate new ways of doing business. Not much different from when COVID forced us to a remote work environment, and we realized that certain aspects of the work can be done efficiently in that setting. Thinking outside the box will definitely be critical to address some of these gaps, because I personally don't see these gaps closing in the near term.
So, like I said, we were out in the market a bunch this year. Did you see any specific regions or departments within healthcare that experienced more severe staffing shortages than others? And if so, why do you think that was and remains the case today, as you just mentioned, and moving forward in the future?
Yeah, so I think the staffing shortages, what we saw are all across all departments at healthcare providers, right? At least we have a unique view for the provider community, and we saw that the shortages existed across the board there, from scheduling, RCM operations, clinical staff, as well as physicians and nurses. The volume of care and procedures continues to increase. Obviously, there was a lot during COVID, but that it's not necessarily that there is a reduction in procedures. It's all we see is continuing increment, and that's where the system is getting stressed with the shortage of people. Volume increases. It's getting tough. With regards to sort of geographic regions, I believe the problem is far more amplified in rural areas of the country, where there isn't enough skilled staff to draw upon or train them. Providers in these areas continue to face challenges in hiring, training, and retaining staff. In addition, what we've seen is these markets are typically a little slower in terms of adopting to the new technology that may exist in some, just being late adopters to technology. But having said that, urban and suburban markets aren't immune either. They face competition for staff from other industries, and especially in regions experiencing economic growth. For instance, in markets like Texas, where we operate quite significantly, and as well as California and some of the Florida, where there is economic growth, the quest to find that qualified staff sort of remains top of mind. So in essence, we see it across the board, probably nuanced in some areas versus others.
So you just mentioned that organizations, facilities, hospitals, providers across the gamut are going to have to start to change the way that they do business and start to look at new technologies. I think a lot of people in the industry are concerned about machine learning and AI replacing their jobs. I remember when computer-assisted coding was pushed in the market, which leverages AI and natural language processing. And those who aren't familiar with NLP, it allows a computer to read in a very similar way to a human. A lot of coders thought they were going to lose their jobs when that tech moved in, which ended up not happening because the solution actually enhanced the coder's job by boosting coder productivity. To your point, it streamlined workflows. It identified text within the medical record where the technology derived the ICD or the CPT code. We're hearing a lot of chatter in the market about ChatGPT, large language models, robotic processing automation. Is Infinix utilizing any of these technologies in the products and solutions today?
Yeah, so I mean, we definitely are looking at all of the technologies you mentioned, but I think just to address the broader points of sort of AI replacing jobs, right? David, you and I have sort of been doing this long enough to know that technology is a productivity enhancer, as you were saying, and jobs get repurposed, reskilled, but rarely do I see them completely go away. And especially in the healthcare industry, don't forget that the industry as a whole is growing and comprises 23% of the US GDP. So I don't believe there is any imminent threat to jobs disappearing. Now, we've been using AI in our solutions well before it was a buzzword for 2023. I personally refer to it, AI, as augmented intelligence, where it wonderfully complements the human intelligence component we all rely on. We have seen productivity uplift of anywhere between 20 and 40%, depending on the business process that we apply these technologies to. It's allowed us to serve more customers and assist them in scaling their operation and addressing their RCM challenges. We're continually evaluating technologies around LLMs, ChatGPT type solutions to see how they can be incorporated, not just within our solutions, but in our business in general, right? What makes us more efficient? And I think it'll be short-sightedness if we don't look at these solutions. The key is to continue evaluating, but be very cautious in terms of deploying in the healthcare environment that we work in. Unlike in other industries, we have to take a long, hard look at what the impact and perhaps some of the unintended consequences of such technologies may be. Accuracy and privacy are paramount in healthcare, so all our solutions need to be evaluated against that backdrop.
But that's a good point. And new technologies bring about challenges and opportunities. What challenges and opportunities do you anticipate when integrating these types of technologies such as AI, ChatGPT, to address patient care and administrative tasks? So
I think that the challenges are really more around deployment, right? And changing user behavior. And anytime change is brought into organizations that are labor intensive and have been doing work in a certain manner, changing behavior is the biggest hurdle that has to be overcome. And at times with a lot of these new technologies, there are issues on the front end. You're taking a new technology on a use case that perhaps has not seen that. And so it's important to carve out the problem, define success metrics, and do it in bite-sized pieces, right? So how we do it, every time we sort of incubate a technology, we develop it, we get it ready for prime time, but then we look for one or two key partners or customers who can work alongside us, understanding that there will be some issues as the deployment goes in that early adoption phase. But having a partnership model, defining what we're trying to achieve and what those goals are, help us to get to that finish line and work together as a team to then get those solutions ready for prime time and broader deployment. So in many instances, when we're doing this thing, if we're working with a nationwide provider, we'll perhaps take one region of theirs or a small geography, work out all the kinks, and then do a nationwide deployment. Or look at one specialty and look at the nuances that come with that and accordingly address it.
So to that point, how scalable is Infinix's technology then to accommodate? You mentioned, national scale, but can it accommodate the smaller healthcare organizations, and why is that important?
Yeah, so right from the beginning, we've maintained the view that our solutions have to be modular and scalable. The problems in healthcare RCM are broad, and all size of providers can benefit from our solutions. I mean, today, as you know, we have many customers across the healthcare spectrum, small local providers with a couple of locations to multi-state health systems and operators, and then nationwide ambulatory providers. Well, one thing we see relatively common in them is, even though healthcare, there is a tendency to look at healthcare as this one monolith, there is, when they're integrated and they're operating in various geographies, they tend to operate very similar to local providers. So we see a lot of commonality there, and we have to address it at the local level. So what we see when a provider scales beyond a local region, the very local nature of healthcare still requires them to operate within their community with the various stakeholders. So our solutions scale, but always are mindful of the fact that even a large nationwide provider may operate individually in the regions that they do.
Very good. We just got a question posed from the audience. Let me read it here. It says, and this is probably somebody who's on the IT side, there's definitely a lot of use cases for machine learning and AI for healthcare administration, but we also need to be cognizant that these technologies can fall into the wrong hands, which leads us to cybersecurity. Healthcare administrators play a crucial role in ensuring cybersecurity, protecting patient data, maintaining integrity, and availability of healthcare systems are a top priority. There are so many things to consider addressing cybersecurity, such as risk assessment, employee training, data encryption, access control, and a bunch of other factors. This person obviously knows what they're talking about. Can you provide some insights to our audience on measures that healthcare administrators should put in place to protect PHI and electronic health records from unauthorized access or breaches? That was a mouthful.
Yeah, so I think in the question, there's a lot of key points on the risks around cybersecurity as well, right? So it's definitely one of the top challenges and threats faced by our healthcare system as a whole. And all stakeholders have a responsibility to take the necessary steps to protect the patient data and have appropriate safeguards in place to deter cyber attacks. All of this starts with having a strong foundation of systems and processes that are supported by focused risk assessment and continuous employee training. I mean, just a simple thing that what we've seen is the most common way healthcare businesses are compromised is through email phishing attacks and social engineering. Having strong two-factor authentication is a simple step, but it's meaningful as a safeguard. And it surprises me how many organizations are yet to put some of those in place. And if they have, the adherence is very poor. So the overall framework doesn't exist. And while data mining and learning, so sort of against the backdrop of AI technologies that are starting to come in, right? Like Data mining and learning is a cornerstone of that. That's how AI engines continue to ingest data and learn and get better at what they do. It's important that it's scrubbed and anonymized, this data, and it's treated carefully so that it doesn't fall into the wrong hands. So we usually limit our access to PHI across the organization to systems that truly need that PHI to process the work stream, after which it's typically archived to prevent any and all unauthorized access.
Very good. And I'm not sure how many people know this, but healthcare data can actually fetch a higher price on the black market compared to financial data, which when I first heard about this, I was shocked. And it has to do around the stolen medical records can be used for various fraudulent activities. You know, if you get patient information, if you get NPI numbers, it's very easy. Well, not very easy, but it's easier to set up a billing shop and send claims into Medicare and get reimbursed and pack up and leave. There's also prescription drug fraud, medical identity theft. What advice do you have for the audience on how to stay informed on emerging cybersecurity threats and trends?
Yeah, I think the personal data in general holds a lot of value for dark web actors, right? It seems almost every day I'm getting an email from some service provider, be it a credit card company or an airline or hotel, that had their systems breached and possibly my personal information leaked. Then they go on to offer free credit monitoring and other containment actions. When it comes to healthcare data specifically, that can be used for even broader nefarious activities that you've sort of outlined. But even further, if you start to look at it, the aftermath of these cyber attacks can bring healthcare systems down. And in this past year, we've heard many news stories around that, where it can truly gravely impact patient care. Because of our reliance on EHR systems today, everything comes to a grinding halt with these attacks. So I think cybersecurity in general will remain a threat to all healthcare stakeholders, and we have to continually learn from each other, deploy security solutions, test our processes, and above all, continue to bring awareness and train all users. And perhaps there's something in there around regulatory environment as well on what needs to be done here to address some of these things.
It's a good topic, and I appreciate the audience for posting that question. Let's jump into another topic, and one of my favorites that always has a lot of activity within healthcare, and that's mergers and acquisitions. I believe the largest acquisition in 2023 was completed by CVS, and the acquisition of Oak Street was around $10.6 billion. And we can't forget when Oracle acquired Cerner. I think it was like $92 a share, which came out to $28.4 billion. Lots of dollars. You see private equity has made some inroads into acquiring physician groups in radiology, physical therapy, some other specialties such as orthopedics and cardiology. Not quite as large as the Oak Street or Cerner acquisition, but significant because of the roll-up in nature of these acquisitions. Can you provide some insights into why private equity has entered the provider space addressing these M&A activities?
Yeah, so I think this is a topic you and I both have talked about quite a bit. And I think in general, private equity is driven by the mindset of consolidation in fragmented industries, right? And then extracting efficiencies through that consolidation effort. And I think healthcare in general has been one area that probably didn't get got caught. Private equity hasn't quite looked at it yet. And over the last year, especially, I've seen a lot more activity. In fact, I don't have stats, but I would venture to guess that healthcare was probably one of the most highly active industries with regards to private equity and M&A activity, given the high interest rate environments. There was definite slowdown in other industries, but I didn't quite notice that in healthcare as much. So it's going to be interesting to see how it plays out, because while they are consolidating at a regional level, at a national level, there is always sort of enough nuances in the local specifics and statewide regulations that there's probably limited efficiencies you can drive through it. So we work with a lot of PE firms that are trying to do roll-ups, and we're always advising them in terms of as they're going through their due diligence on how the RCM operations are doing, what value they can bring to that by consolidation, as well as just further improvement in streamlining and bringing technology into the mix. So we continue to do that, and we see that there is tremendous value that can be generated and economies of scale that can be put to use. But at the same time, these are physician groups more usually that are being acquired, and there has to be sensitivity given to the fact that they are taking care of patients at a very local level.
Some of the private equity groups that we have interacted with have leveraged our technology to assist them in due diligence and other activities, but we didn't really go into detail on, when we were talking about the platform, how Infinx leverages machine learning and AI to assist our customers in reducing denials and predicting reimbursement at the claim level. What can you provide the audience on how we've positively impacted our customers through our accounts receivable and denial management product?
Yeah, so the way we sort of look at it is our approach is first analyze. So get a pulse on the health of their RCM operations, and specifically AR is a great area, right? Because there's usually dollars locked up in there that can be converted to cash. So first is analyze that, figure out where the hotspots are, prioritize the claims that we believe through our AI machine learning engine can result in the most amount of cash in the least amount of time with the least amount of people put to work on it. And what we've seen is typically an uplift of, on the low end, at least 12 to 13%, and in many cases up to about 30% in looking at them in working that AR and actually being able to convert it to cash. And all of this works because the first step in it is ingesting the data, analyzing it, and then putting our AI machine learning algorithms to work to initiate that, and then bringing in the humans, and that sort of bringing in the aspect of tech-enabled services that whoever is working the AR is now more efficient and outcome-driven rather than productivity-driven.
So we got another question. It's not really a question. It just says tech-enabled services, question mark. That must have been from your comment earlier. I think one of the cool things about our product offering is that they are tech-enabled services, and obviously some in the audience may not be familiar with that term, but to help you out and to make sure I'm on the same page as you, Jaideep, from my perspective, a tech-enabled solution enhances or enables operations teams through the technologies that are applied, and then combined with that human effort, like you just mentioned, augmented intelligence. Those technologies assist in everyday tasks, such as prior authorization or AR follow-up. Would you agree with that? And if you do, can you share why Infinx has taken that philosophy when it comes to our product development?
Yeah, so I fully agree with what you just said there, right? And sort of the reason we've gone down this path is from very early on, we saw, specifically in healthcare RCM, that there is a bit of a last mile problem here, that you can deploy technology, you can bring in automation. However, many use cases, you can't take it from start to finish in a completely technology automated environment, and there is human intervention required or human assistance required. And so all of our solutions are built with that mindset in place. And when you talk about tech-enabled services, that's essentially what we're saying is there is a technology at play. It's that first line of defense, like I mentioned earlier, but there will be scenarios where humans will have to come in and assist that process. And those could be team members from our team or from our customers' team, or working together. And that's where the strength of our workflow solutions start to come in, where you're able to allocate work between various teams, monitor productivity, monitor outcomes. So in essence, the technology is sort of at the heart of any engagement we do. And then, but we recognize that humans are the ones that have to interact with this technology, and where they work from, how they work is what's all orchestrated here.
So Jaideep, we've covered a lot of ground here, and we have about 3 minutes left. I know a big portion of this session of office hours was based upon what you've reflected on over the years and your milestone birthday of 30 years of age. Congratulations on that. You're looking good. In closing, what thoughts do you have for our audience on what you've reflected on 2023?
Well, firstly, when I reflect is I continue to reflect the impact probably Taylor Swift had on 2023 in the entire world. And you have a daughter, I have a daughter, and the impact there and the dollars we spent there. But outside of that, I think, firstly, I'm grateful to our amazing team that has really positioned Infinix as sort of this first choice for RCM needs for our customers. We continue to prove value and maintain very high NPS scores across the board. And that's a testament to the approach we've employed, right? What I was mentioning at the top of the call around over the years, we keep our customers at the center of it all. And as I'm sort of looking at 2024, as much as I'm really excited about all the technologies at play, all the amazing things we're trying to do, the most exciting piece is there is an opportunity to transform revenue cycle operations, right? Through the use of technology, through small steps, one at a time. And that transformation will be more when we look back as a reflection, rather than some flip of a switch that'll do it today or tomorrow. I'm looking forward to the ability to broaden our reach in the market. We've sort of addressed it from a specialty by specialty perspective, and we've seen the nuances that exist there and how we're able to really impact. And I've firsthand witnessed the impact our solutions have had on patient satisfaction and care access. And I'm hopeful we continue on that journey. I mean, customers continually tell me after deployment of our solutions how they're able to focus more on patient care, how they're able to see more patients because we've sort of removed some hurdles in their administrative tasks. So as I look, sort of reflecting back and looking forward, and sort of, as much as you're very kind to call me a 30-year-old with my 50 years, looking back, I feel some of the journey points from 5 years ago that we started have really yielded the results and what we had hoped. And we're sort of reloading for the next 5-7 years on an amazing set of technologies that we look to bring to market with, again, focus on the customer problem, not technology for the sake of technology, but really addressing the customer needs. So very excited as we go forward.
Well stated. Appreciate your time and the audience's participation, and it's always been enjoyable this year doing office hours with you, and happy holidays to you and to our audience.
Yeah, thank you, David. It was fun as always, and look forward to continuing the series into the new year. Happy holidays to you as well.